just imagine you all out with your friends or maybe your family members, and one of them collapses from a heart attack. Would you know what to do?
No.
Well, I'll let you know what exactly you can do. I am a CNA, which is a certified nurse's aide, and I am required by law to be updated in CPR. So I'll be letting you know how to actually assess the emergency, call EMS, and properly administer CPR. According to the American Red Cross, the first step that you're supposed to do in this situation is to make sure it's safe for you and the victim. You're also supposed to ask the victim if he or she is okay, and if they have no response, then you are to call for help. There are 3 ways to call for help. One is to simply call 911. If 911 is not available for some reason, you can call a local hospital or police station. If neither one of those are available, you can always call the operator, and she should get you some type of help. Also, if there are more people around, it would be best to assign someone to call EMS, because you'll probably be busy trying to help the victim. The next step would be to actually administer CPR. The first thing you want to do is position the victim in a stable position. I'm gonna get down here. Position yourself next to the victim's shoulders. Then you're going to check for CAB. A lot of you may know of it as ABCs, which it has been for years, but it recently changed to compressions, airway, and breathing, mainly because they feel that compressions are more effective than the actual breathing, and for certain reasons people don't want to administer breathing like that. You would first check for breathing in the victim. If the victim is not breathing or you don't feel a pulse, you would actually start 30 compressions, 2 inches deep at least. I'll show you the way to do that, which is actually take the palm of your hand and center it in the victim's chest. Take your other hand, interlace it, and do a quick 30 compression motion. A good way to remember this is to hum the song everyone I'm sure knows is Staying Alive, so that'll help you do the 30 compressions. People who are not trained actually just stop at the compressions. They don't want to do the breaths because they're not trained in that. If that is you, then you would just continue with the chest compressions until help arrives. Some people often talk about the pops and cracks when you're doing compressions, that they're completely normal. You actually are going to break a few ribs if you do it properly. So that's completely normal. The next thing you're going to do is check the airway by doing the head tilt and chin lift method, which is actually this. On Teddy, it's a little weird, but yeah. Make sure the airway is open. Then you're going to pinch the victim's nose and make a seal over the victim's mouth and yours, and you would administer 2 big breaths each time, watching for the chest to rise and fall each time, making sure that definitely happens. Repeat chest compressions. After you do the breaths, you would complete the 30 compressions again. Then you would also give 2 more breaths. And then if not breathing, then you continue with the CPR and compressions and breaths every 2 minutes and until help arrives or the victim wakes up. You will repeat these cycles for 2 minutes. Check for breathing after every 2 minutes. If the victim is breathing, obviously you would stop CPR, but if not, you would continue it until the EMS arrives. In this speech, I have shown you what else? I don't know what else I can say. It was only 4 minutes. Okay. In this In this speech, I have shown you how to actually assess the emergency, making sure the client or the victim and you are safe. Then you can actually call EMS. I've actually shown you a couple of ways to call EMS. Then you can properly administer CPR on the victim. And I hope that this information can actually help one of you at least save a life if you can. You'll have to take off for that.